Well, we continue to have questions about the coronavirus and vaccines. Our Dr. Mallika spoke with Paula Eben to answer some of them.
Dr. Mallika, our first question is from Tracy, who asks, how bad are the side effects if you have COPD or have had a double bypass? I'm 53 with COPD, and my mom is 70 with a double bypass.
Well, you know, having underlying lung or heart disease doesn't mean that you're more likely to get side effects or less likely to get side effects. Sometimes it's really hard to predict who's going to get side effects and who isn't. We know that people who are older tend to have fewer side effects than people who are younger. Some people, many people, have no side effects at all. And if you do develop side effects, they do tend to be mild to moderate and usually resolve within 24 to 36 hours. So obviously talk to your doctor, but please, both of you get vaccinated.
George asks, am I correct in assuming that the air dryers in many, if not most, public restrooms potentially do more harm than good, actually blowing the virus onto your hands?
So this has been looked at very carefully because I know at the beginning of the pandemic there were some concerns that might be the case. But in fact, electric hand dryers are a perfectly safe way to dry your hands in a public restroom. You can use paper towels, you can use the hand dryer, but you are unlikely to get infected from the virus being blown off someone's hand and into your airspace.
Sounds good. Good to know. Every time I use one, I do question it a little bit. Deborah writes, I received my second COVID vaccine on March 29th, then found out a few days later that I had shingles. Will having shingles have any negative effect on my vaccine? Will I have to get another one?
You know, having shingles shouldn't really have an impact on the effectiveness of the vaccine. And no, you shouldn't need to get another COVID vaccine unless you're scheduled to get your second dose. Actually, you already got your second dose, so you're all set.
All good to go. Kate in Natick asks, I received my second dose of the Pfizer vaccine on Friday. On Monday, I was at my orthopedics office and received a cortisone shot for bursitis in my hip. Will the steroid shot reduce the efficacy of my vaccine? I'm worried.
Don't be worried. Yes, there is a theoretical risk that getting a steroid or cortisone injection around the time that you get a COVID vaccine could affect the impact of the vaccine by suppressing your immune system. But honestly, it's a theoretical risk. Experts are suggesting that you space out your cortisone shots so that you aren't getting them around the same time you're getting a vaccine, but it is unlikely to have a meaningful impact. I think you should just celebrate the fact that you are vaccinated.
All right, Dr. Mallika Marshall, thank you so much. Dr. Mallika offers her best advice, but as always, consult your personal doctor before making any decisions about your health. If you have a question for Dr. Mallika, here are the 3 ways to reach her. Her email, drmallika@cbs.com, on Twitter @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.